Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Systemic effects. In systemic effects on cardiovascular system, they cause central hypotension. There will be shifting of fluid from pulmonary circulation to the systemic circulation, leading to pulmonary edema. Opioids acts on respiration, causing respiratory depression. That is, there is decrease in rate of respiration followed by decrease in tidal volume. The most common
because these opioids will shift the fluid from the pulmonary circulation to the systemic circulation, so they are used in the treatment of pulmonary edema. These also cause respiratory depression. They decrease the rate also and also the tidal volume. These are the most common
cause of death in opioids is respiratory depression. Opioids will inhibit airway reflexes. Maximum inhibition of airway reflexes in opioids is seen in sufentanil. In the CNS or in brain, opioids will increase intracranial pressure. They decrease the intracranial pressure in the resting brain and they increase the intracranial pressure in injured brain. That is the reason why opioids are contraindicated in head injury. In the CNS, opioids will activate chemoreceptor trigger zone causing nausea and vomiting. In the eye, opioids causes miosis. In the muscular system, opioids will result in muscle rigidity leading to wooden chest syndrome. The treatment of wooden chest syndrome or muscular rigidity is naloxone. Naloxone is an opioid antagonist. Maximum muscle rigidity is seen by alfentanil. In the renal system, opioids causes urinary retention. In the GIT, opioids are responsible for constipation causing opioid bowel syndrome. In the biliary tract, opioids causes constriction of sphincter of Oddi, increasing the biliary duct pressure. Opioids can be used for biliary colic and pancreatitis. Pruritus. Pruritus can occur in opioids. In any route or in usage of opioids nasally can result in pruritus. Treatment of pruritus is naloxone. Naloxone is not preferred because there can be reverse analgesia. Other drugs which can be used for pruritus are ondansetron, propofol, and pentazocine. Opioids can also result in dependence. Opioids can cause tolerance. All actions tolerance is seen in all actions except meiosis and constipation. Tolerance is seen after chronic use. Acute, acute opioid tolerance is maximally seen with remifentanil. Opioids induced hyperalgesia. In opioids induced hyperalgesia, there is increased pain due to opioids. It is seen mainly with remifentanil due to activation of NMDA receptors. Treatment of opioid induced hyperalgesia is ketamine. Local
So summary in the systemic effects of opioid. First, in the CVS, it causes hypotension, and opioids will shift the fluid from pulmonary to the systemic circulation, so thus they are used in pulmonary edema. They cause respiratory depression. They decrease the rate of respiration mainly more than the tidal volume. They are the most common cause of death in uh, most common cause of death by opioids is respiratory depression. They inhibit the airway reflexes. Maximum decrease in airway reflexes is by the sufentanil. In the CNS, they increase the intracranial pressure in injured brain, whereas they decrease the intracranial pressure in the resting brain. So as a result, because they increase the intracranial pressure mainly in the injured brain, opioids are contraindicated in head injury. Opioids activate chemoreceptor trigger zone, resulting in nausea and vomiting. They cause meiosis, muscle rigidity. So because they cause muscle rigidity, they cause wooden chest syndrome. This wooden chest syndrome is maximally seen with alfentanil. The treatment of wooden chest syndrome is naloxone. They cause urinary retention, constipation, so they result in opioid bowel syndrome. They cause constriction of the sphincter of Oddi and thus increases the bile duct pressure, but still we can use them in biliary colic and pancreatitis. They cause pruritus, and the treatment of pruritus due to opioids is naloxone, ondansetron, propofol, and pentazocine. They can cause tolerance and dependence. Tolerance is seen mainly in all actions except meiosis and constipation. The maximum tolerance is seen with remifentanil, so it is called as acute opioid tolerance, and they also cause opioid induced hyperalgesia, which is maximally seen with remifentanil. NMDA receptors activation results in opioid induced hyperalgesia, and the treatment is ketamine.
Thank you and thank you for watching.